Hi, welcome to Candid Chats on Cancer. I'm Mary Robinson.
I'm Jamie Moore. So Mary, this is a topic that I don't know whether to be excited about,
Or blush?
anxious about, or start blushing about.
Well, I have wanted to have this episode for a very long time because I think it's an important topic.
Very.
And Briar Jerka is with us today, and she is a certified sex therapist.
I got that.
I know, isn't this going to be fun? She works for Associated Counseling Professionals.
Correct.
And I don't know where that's located.
We are at 132nd and Center.
Okay.
So where there's a combust of a lot of construction right now.
Right.
In the Prairie Life building.
Okay.
So we find it funny that I do sex therapy and we work above what is called Limitless Male Medical.
Yes.
So there's a testosterone clinic below me.
Oh,
and
how convenient.
And I treat low women with low desire. So it's just an awkward moment when my poor patients have to come in and actually
So you treat
through.
only women?
I treat only women and couples right now. I'm certified to treat men, and I do like prostate cancer groups and support groups, but my clinic is predominantly women and couples.
Oh, interesting. It's nice that you bring in the couples too, because
Absolutely.
Yeah.
it's not just the woman that's going through it.
100%. Actually, that's how I got into treating cancer and sex in the first place. I was 25, and one of my really good friends' wives, old girlfriend at the time, was diagnosed with cervical cancer.
Right.
And at 25, she had no idea what to do. It was super progressive. There weren't any treatments except a hysterectomy. And my good friend, her boyfriend at the time, called me in the middle of the night crying. This is not a man 25 would cry. Was like, Briar, I don't know what to do. We've been one appointment. Nobody's asked me how I'm doing, what to do, how to help. I'm just at a loss. And so he called me for therapy, but I was like, all right, this is a need. And so I started talking to women more and more and more through my cancer groups, and so many of their spouses were like, we don't know what to do. So actually I started the cancer sex therapy world working with partners.
Right.
And then got into actually treating the women more independently.
So you were an actual counselor before this, but then they started calling you about the sex piece?
Yep, I've always been a sex therapist. That's kind of been my forte. I started working with like littler kids in the state system, and that's really just gut-wrenching after so long.
Oh, I
and,
can only imagine,
my mom is a retired nurse, and my dad was a retired physician, so I always knew the medical field. And there was more and more of a need that I saw in the training for cancer patients, and how, again, just as you guys said, it's so neglected and it's taboo. We can't talk about it. People don't want to ask the questions because they're embarrassed, or their medical providers are like, we don't have answers for that. Like, I can't tell you how many women I've had who've gone in for, they've had their hysterectomies or they've had their radiation or chemo, and they go in to see their oncologist, and they're like, well, just put some lube on it and just keep at it. And I'm like, oh, no, like there are tissue damages and muscles that need to be healed, and even the medical community is very undertrained.
Right.
So it's a tough field in general.
I don't think that ever once in any one of my office appointments have I ever been asked about the sexual part of having cancer. Now, I have colorectal cancer, and so I have 2 ostomy bags.
Absolutely.
I went from 6-pack abs to now I have 2, one on each side. And so sex was a very big part of our life, and then all of a sudden, because you're on chemo,
Yep, you can't.
sex changes.
And it's more we always say cancer itself doesn't ruin your sex life, it's the treatments for cancer that do. It's the radiations, the chemos, the surgeries.
Now, I didn't have surgeries. I had a stem cell transplant. And so, the chemo took my libido away. And so, I was just like, oh, I'm not really that interested in doing that right now. And, it's probably very difficult for the partner, so my husband was like, I don't know, he's just been really good about things. And as far as you saying that your doctor didn't ask questions, well, mine didn't either, but I'm the one that asks. And
Good
he's
for you.
like, well, what about, talking to your OBGYN?
Yes.
So I do think that sometimes maybe, and I'm just, I shouldn't probably say this, but maybe the doctors don't feel as comfortable because that's not really their forte.
Absolutely.
And so I haven't, it just, whenever I have an OBGY appointment is when I ask some questions, and then we hope for the best. But maybe a therapist would be beneficial.
We work a lot in a multidisciplinary treatment team. So I work very closely with the oncology social workers, and it's nothing against the oncologists themselves. Their jobs are to save lives, and by God, they're good at it. And so let them be good at it. But they don't address the what happens once, here, you're better, go live your life.
Right.
But the social workers, the nurses, the advocates, we really do a lot of work with them. And then, yes, the gynecologist, since I predominantly treat women, I meet even a multidisciplinary team every other week. I'll get together with my pelvic pain specialist, my pelvic floor physical therapist, my nurses, and me will sit down and go over patient care, because it just is so many times we miss pieces,
Right.
and it just needs to be talked about. But it's amazing how many times when I speak, I'll ask, the first one I ask is, how many of you were ever talked to about sex in any of your cancer appointments? I mean, I've been to sessions where there's 200 people in the audience and not one person raised their hand.
Yeah.
Wow, that's interesting, because maybe I'm just too open. I feel like I've been through so much. I'm like, I might as well just ask, because I'm to the
that's
point
good
where,
for you.
it's my life. And if I want to be happy with any avenue, not
Right.
just sex, but just, you got that?
Yeah, I got it.
I mean, just any avenue of my life, you have to ask.
You have to ask.
You really do, because I think it's a touchy subject for a lot of people, even doctors.
Well,
Absolutely.
I think it would be, my doctor's a male doctor, and I don't know if I really want to talk to my oncologist about sexual problems, or
Absolutely.
that I don't feel like I'm male anymore because you've got 2 bags hanging off of you or something like that, or you just don't feel attractive.
It's the body image changes. That's the biggest thing we see in therapy that people bring to us is how do I, one, accept my new body and the way I perceive it. Even if there's been no physical surgeries or changes, it's
Right.
I feel different. And how do we psychologically and medically help those two come together?
Yeah.
And I'm pretty open like that too. And I think it's the education. I tell people when
Yeah.
you talk about sex 10 hours a day, 6 days a week, I talk about it like, are you having spaghetti for dinner? So people look at me like, you can't say that in here. I go, oh, yes, I can. It's perfectly fine. I've even been kicked out of the Cheesecake Factory for talking about sex because I offended somebody. But I feel very passionate that that's the problem. It's so taboo. And especially
Right.
with cancer, they need to be talked about incongruent. But the timing is usually the problem. It's, do we talk about it when somebody first comes in for a diagnosis, or is it, they're heading out of treatment and they're now heading home? Is that the proper time? So there
Right.
is a question. Some people aren't ready to hear that. I mean, am I going to die or not is first question,
Yeah.
cancer.
Right.
Not, hey, am I going to be able to have sex when I get home? So finding the balance.
That's
I'm not
true.
quite sure. I think in our house it was, hey, can we have sex?
It's important.
If my husband is on chemotherapy, bless his heart, a little hard if he lives, but
If he's going to, can we please do this?
can we,
Yeah.
can we please still
Are there
have
any
sex?
restrictions? Whatever. I mean, I don't know. I'm just throwing that out there.
Are there any restrictions that you can think about?
It's really person to person, but we always talk about that there's some research out there that says, during chemo, you should be using a barrier method just because we don't know about the passing from chemo to one person to another, depending on the type of sex you're having. We always say, again, as a non-medical provider, consult your medical professional just to be sure there isn't anything that you shouldn't be doing. But there is no reason why a person going through cancer treatments can't have sex.
Right.
But this
Whether
is,
they feel like it or not.
is
Is-
the question.
Yeah.
And that's where we talk about, okay, the restructuring, which I think I kind of talked to you about in our email, was how do we restructure sex where maybe we remove the whole penile vaginal focus sex, which is very American culture, and get into, okay, can we just lay naked in bed together? If that's all
Right.
we have energy for today, then let's just make sure we do that. But we're so an all or nothing society when it comes to sex that sex therapists, we're trying to really restructure that for our medical diagnosis.
That's
TBI,
interesting.
strokes, cancers.
It's really, I've always thought of the all or nothing, and
people
that's
do.
important to note. Yeah.
But snuggling for me is, I like that the most of anything.
It's the intimacy.
It's, especially like with neuropathy.
Absolutely.
When people lose the feeling in their hands. Some days I didn't know if I was touching my wife or if I was touching,
The sheets.
the blanket next
Yeah.
to her, I was like, hey, is this you? And she goes, yeah, but, because I couldn't literally,
You can't feel it.
Yeah.
can't.
And that's too where we talk about kind of exploring bodies from head to toe. A lot of my patients will talk about, again, don't go straight for those erotic zones, which again, culturally we're taught to
Right.
go to, but start with, massaging the head and the ears and the neck and the chest and the arms and the legs down to the feet. Like there's so many nerve endings that just get neglected that are actually the ones we need to wake up when there's so many other nerve endings that are deadened due to the chemo and radiation. So it's reteaching your body. And sex is a learned behavior outside of that lovely 72-hour window biology-wise for
Right.
reproductive purposes. Otherwise, it's all learned. And so as humans, we have to reteach ourselves. And nobody just takes the time to do that until you have to.
Yeah.
Yeah, exactly. Well, you feel like a huge part of sexuality and cancer is the grief process.
Absolutely.
Can you talk a little bit about that?
Yeah, I think it's the kind of the analogy I give to patients is if, let's say you're driving down Dodge and you need to make a right. So you're, all in 65 miles per hour and you need to make a right onto the next exit. You don't just make a right or you're gonna flip your car. You're going too fast. You don't stop and really acknowledge the turn's coming up. I need to get over, I need to signal, I need to slow down. So with grief, what happens with cancer patients and a lot of chronic illnesses with sex is, okay, let's just forget about it and move on, and I'll just do it this new way. But I haven't grieved the loss of the old way. And so just like driving a car, you have to slow down and really acknowledge and pay attention to what's coming up, what you're feeling, and then make that new direction, or as literally that right-hand turn, you're restructuring a new way of being sexual. So with grief, a lot of my patients, we just go through the stereotypical grief process. There's the denial, the bargaining, the anger, the depression, and then the acceptance. And the acceptance looks different for everybody.
Right.
Depending if you're single and getting back into, your sexual relationships and dating, or if you've been married 30 years. There's a grieving process not just for you and your body and the feeling like a man or feeling like a woman, but what was my relationship with my spouse like before? If you had a really thriving sex life and then you got hit with cancer, like we said, nobody talks about it. You have to grieve that previous self to accept this new one.
And that's why it's important that you have couples too, because your spouse needs to know that they're still loved, or whatever the case may be, and there's light at the end of the tunnel.
Yeah, they're still loved, they're still attracted, you're
And it
still
has
attracted
nothing to do with them.
No, it's, after 6 rounds of chemo, it's kind of like,
I'm tired.
it's kind of like, I love you, honey, but
it's bedtime. I'm kidding.
No, but that's true. We say don't have sex at night. At night is not smart. Like if you have jobs, cancer, kids. I mean, it doesn't matter what you have on your plate, cancer specifically, because it just wears so much of your body out. No, morning time, afternoon delights. I mean, I tell clients, like, if you can take a half day from work, go home and just be, because you're going to get a lot more out of it than trying to get through your whole evening, your whole day, and then try and have sex at night when everybody's, you're tired, go to bed. I mean, literally, your body needs that rest.
Yeah.
Back to the restructuring, you had to change the way we think about it, is nighttime is not the right time.
Yeah, that's
and
true.
That's the time that most of us think that sex occurs is, well, the kids are in bed, house is quiet,
Yeah.
So so now we know to kick the kids out at lunchtime.
Right.
Go outside and play.
Time to go play.
Take a few times. I said that's why we have locks on doors. It's okay.
Yeah.
And like I said, like with that chronic illness of cancer, there's always the fear of reoccurrence. There's the fear of what do we do if this comes back? And like I said, it doesn't matter if it's cancer or like I've done a lot of work with the TBI and stroke community too. And it's that whole, it's just going to constantly be changing. I don't care if it's your 20, 30, 40, 50, 60, 70. My youngest client is 19. Who was diagnosed with cervical cancer, and my oldest client is 82, and they have a very thriving sex life, but it just hasn't been penetrative in 2 decades, and they're the cutest little things ever because they really focus on the intimacy, the connection between the two.
And that's something that probably not some of us don't function or don't think about at all anyway. Is the intimacy. It's more the act than the intimacy. And with cancer, I think you get a whole new idea about what love is.
Completely.
My wife, I can't imagine having my life without her. But poor thing, like Tim, there are times where they've gone, sexless. But my wife is pretty straight open about things with me. She goes,
great.
Sometimes, my vibrator gets a lot of work and sometimes it don't.
I love it.
I think my wife's
It's what it should be. And we're very open about that. I give out, pages and pages of ideas and arousal devices and techniques and exercises to do because, again, it's that so taboo. Like, Briar, I can't look this up. What if I get arrested? I'm like, you're not going to get arrested for looking up vibrators, I promise. But back to the nerve ending damage that can happen with that. Vibrators are a great way to wake up those nerve endings. So even if you're going to use it on your feet, or for my breast cancer patients, it's around the side of the body. It's a way to wake up nerve endings. And so why not use it if we have the tools to do so? Because I always say vibrators don't come with a, this is how you use me. It's completely up to your imagination between you and your partner, how that works. So yeah, good for your wife.
Yeah.
Yeah.
She's just drop dead beautiful, and I can't. And I just giggle at it, like, you know?
Well, and then you also, I guess I'm kind of wondering, do you ever have clients that are maybe in denial of them thinking anything's different, but their spouse is like, yeah, it's way different? Do you ever have any of that?
Not as often, but I definitely have had some patients who are stuck in that denial phase of grief. And that, you know, okay, I'll get my treatments and then I'll just go live my life and everything will be fine. And I'll see them at some of the cancer events around town, and then it'll literally be sometimes be years later, and I'll see them back, and like they'll come into my office and be like, I saw you at an event, and I'm ready because I wasn't ready then.
Right.
And a lot of it is the acceptance of you're just not quite ready to let go of your previous self to accept this new one. And that's hard.
It's very hard to let go of the previous self.
I always call it your new normal, because
Yep.
I don't think
Yeah.
it's
Exactly what it is.
ever going to be the same.
No.
My life in general, not,
No.
this has nothing to do with the sex part, but just in general, your life changes. Everybody in your family changes
Yes.
around that. Yeah.
And that's the caretaking role that actually comes up a lot of, I don't want to hurt my partner. I don't want to cause them pain, you know, post while we're getting back into some sexual intimacy. And I'm like, let them be your guide. Let them tell you where they're at. But family and partners are so like, no, I can't, I don't want to do anything wrong. And I'm like, but the communication's lacking. Because nobody teaches us to talk about sex well enough, sex and cancer. So that's why it's so important to talk about.
Yeah, it's like a private thing, you know. Or when I was
Yeah.
growing up, it was. I don't know what it's like in the school system now, and you know,
It's
as
the
far
same.
as when they teach that kind of
same.
stuff to kids.
Hey, I
But-
went to a Catholic school that, you know, we had such education was the priest.
Yep.
And, you know, there was a lot of us in the room going, but,
Yeah.
you know, going back to cancer and how it changes our life, it changes it from the minute you get the diagnosis.
Correct.
It's not even that you're chemotoxic or something like that. You know, the second you find out you have cancer, it's kind of like your whole life changes, and then all of a sudden, you know, going on, you know, intimate vacations, you know, leaving the
Correct.
children at home and going away for 2 or 3 days as a couple. All
That
of a
doesn't
sudden,
really happen.
that doesn't happen anymore. Or do I want to take a 3-hour ride to Kansas City? But we forget that we can just literally go across the river and go to another place. But it seems like those things kind of stop too when you first get the diagnosis.
Agree. And that's where a lot of the times people come in and say, oh, you're going to teach me how to have better sex. And I'm like, yeah, that's part of what I do. But the other part is how to reconnect intimately.
Right.
And that's not always about the sex. Sometimes that's just about the communication, about the, you know, give me a hug or show me some affection. And because again, and a lot of times when your sex life changes, your physical relationship changes.
Right.
So we suddenly start to pull away from hugs and kisses and affection. And then what comes next is the emotional intimacy. And before we know it, we're not feeling very loved, or, you know, we're feeling very off. And we need, again, to talk about what's missing. And
I
it's
have
not
to.
just the sex.
Exactly. And I have to say, like, when I went through the leukemia stem cell transplant and whatnot, I was in the hospital for 3 weeks at least for one of those times, and then I was in isolation for 100 days. I was allowed to be with my family, but not only with my spouse, but my children. They would come and ask for hugs, and I would give them a hug, but, you know, like my youngest, she couldn't sit on my lap, or I would ask them to change their clothes after they came home from school, and they always had to wash their hands, and I just did that because I was trying to protect myself from getting sick.
Correct.
And which it worked. But as that 100 days was over, it was really hard for me then to get over some of my germ phobias because I was used to not giving kisses and not cuddling and that kind of stuff. And so I do feel that it's an unspoken thing at my house, although I'm very huggy, you know that. I hug all the time. But as far as with my spouse, you know, I might be like, oh, you were coughing. Are you okay? Can I kiss you?
A little more hesitant.
Because I'm kind of like that
A little more
still.
hypervigilant still.
Yeah.
And it's a learned behavior.
I think that was the first thing that actually went with us was kissing. Because, yeah, she didn't want to give me, you know, like she had a little sniffle. And she'd like, you know, love you. And
High
it's
five,
like,
honey.
Yeah. So, yeah, kissing, I think, but it was the first thing that came back.
Correct.
You know?
Oh.
And that's what we tell couples actually start with. Kissing is one of the most intimate things two people can share. I kind of refer to it back like Pretty Woman. Like Julia Roberts didn't kiss anybody in that movie because it was too intimate. And I tell clients, like, that's exactly why you need to do that. Kissing's a very intimate thing that can be very affectionate, it can be very loving, it can be very erotic, but it can be so many different things. And it can be very sexual. You kiss your husband probably differently than you kiss anybody else, or you kiss your wife differently than you kiss anybody else. So it's still very intimate, even if you're not having sex. So
Kissing is a big part.
It is.
it's fun. I can see you guys like reminiscing in your own head about like, oh, I like kissing my spouse.
You do, and you know, those are the little things that we just don't ever talk about or really think about. I mean, we talked about not kissing, but it was always in the protective way.
Correct.
You know, I'm not kissing you today because I was around somebody that had a cold and I don't want you to get a cold.
Yeah.
Or I don't want to kiss you today because I just had chemo yesterday and I've got a chemo pack on and, you know, I'm toxic. And
Correct.
so next thing you know is that little peck on the cheek, you know.
Well,
so
and it's hard to get back into that role again of the way things were
Yeah.
after something like that. So
Correct. And that's the awkwardness that my clients will come into my office and talk about is how do we get back to this? 'Cause
yeah, so what
kissing's
are some
awkward.
suggestions for restructuring?
Again, we take things really slow. We'll start with an activity called Sensate Focus, which is a touching exercise between a couple that doesn't involve erotic parts to start with. So again, bounding back to touching the whole rest of the body and then touch back and forth, and then we'd add back in breast. And then depending, again, my breast cancer patients, we might actually skip that and add a different area. Just again, we don't trigger certain things. Then we'd add back in genitals and buttocks, and then we'd add in mutual touching together, and then intercourse. So it's a progressive build up so that things don't feel so awkward. But I tell clients all the time, if it feels awkward, you're probably doing it right. Because you're probably doing something you haven't done in a long time.
Yeah. Even though you've been with your spouse for however many years.
Could be 40 years.
Yeah.
well, it's like you have to relearn. It's
learned
like
behavior.
all over
But it's like
again.
riding a bike. It always comes back to you.
Oh, we don't say that.
No, I'm kidding.
I can't ride a bike. That's why I can't use that example.
Okay, then what is it like?
I don't swim and I can't ride a bike. I'm like, these are really bad things that I can't
I
use
can't think of
examples.
a good analogy. We'll just stop.
No,
We'll just stop with it's like riding a bike.
But it's true for everybody else, yeah.
Yeah, just not you.
Correct.
Okay.
One day. 36.
I can't
maybe
even
I'll
think
learn.
about another one. Sorry.
I can't either.
I'm
I can't
a
think
loss
of
for
another one.
words. So if you come up with something, go for
Yeah,
it.
let us know.
Yeah. Well, I just really think that this is an important topic because I've had friends even say things like, you should do a show on this because, you know, we've had the same issues in our household and whatnot. And I think it's something that's kind of
Yeah.
scary for people.
Well, it's not just cancer. It's anybody with a chronic illness.
Completely. And
You know, it's the same way. You know, if they have a chronic illness, like you have like you were talking about, a stroke or a traumatic brain injury, where all of a sudden here on down doesn't even work anymore.
And there's so many great resources now and tools and techniques to really help anybody in any situation. My father had prostate cancer a couple years ago, and I went to all of his appointments with his oncologist. And of course, I'm that weird, awkward daughter that comes in and said, well, what about sex?
Yeah.
And they're looking at me like,
Was
wait, aren't
he
you
looking at you like that?
The doctor was too, and I'm like, no, it was for more of an education, because I don't treat as men anymore. So I was curious what were the new treatments and how would he address that. And then my mom had a TBI, had a brain aneurysm in 2012 while driving, and so was in Madonna for 3.5 months. And
Right.
so I every day would go up and talk to the OTs and the staff and the nurses and be like, strokes. I'm like, so how do we do this? And so I went and started doing support groups for the stroke patients at Madonna, because I was like, this is important. These people are heading home and are getting back to their lives. I want them to have some tools to help them reconnect to their spouses and partners. So for some odd reason, it seems to find me in some roundabout way, but like I said, I love talking about it. I love spreading information about it. We're just not an open culture that talks about it. And I think if we did, it wouldn't be so taboo, and we'd probably all be much happier sexually.
Without a doubt. I mean, yeah, we're taught not to talk about
Correct.
it. You know,
Just the
even
opposite.
even amongst a wife and a husband, we're almost taught not to talk about it. You know, there's the act, and then we all don't talk about it anymore.
Yeah, I think it's funny for sex education, you know, people will tell their kids, well, if you can't talk about it, you shouldn't be doing it. I'm like, so how many of you guys actually talk about it? Because I'm
Right.
pretty sure you don't either. And I tell my clients coming in and talking to me about it, it seems really awkward at first, but I don't have an intimate relationship with you. So it's actually easier to come in and talk to me than it is for you to go home and even talk to your own spouse.
Right.
Because there's so much emotionality and intimacy involved between partners. I'm a stranger. You only see me in the confines of my little box office, and we talk about it, and then you go live your life.
Yeah.
And so that's a lot easier sometimes than even friends or loved ones to talk about sexuality. And like I said, with the cancer world, if we can get the medical community to continue to jump on board, it'll be a much better space, because then patients won't have to be as brave as you to ask those questions, because it's like, I want the information, but I need the medical providers to have the information to give back, and they don't always do it.
So how do medical providers get more information? Because it's like, there's no pamphlets,
formal, there's
nothing
no
like that.
formal
You know,
education with them. A lot of the times I'll go and do a talk to the med students, and again, they get an hour and that's it. Like,
and they walk away going, nah.
Some of them, yeah, but I always say just find one person in one clinic, just one person in every clinic that's comfortable talking about sex, and have them be your go-to sex person. Because then the patients at least have somebody within the context of that clinic to go to.
That's great
and
advice.
It's much, much better. I mean, most of the major health organizations in town are really picking up, you know, where they're entering that sex world much more often. The Med Center is coming up with a huge whole practice to treat sexology or sex and cancer, which is awesome.
Yeah.
So we're really coming a long way, even in the past probably 5 years.
And are you able to prescribe, or do you just?
I do not.
Okay,
Yep,
so
I do.
You
Just
do the
talk therapy.
counseling. Mm-hmm.
But I'm in connection with all of my collaborative team, and so we make sure that if those are needed, there are a lot more medications specifically for women that are now being FDA approved for sex.
Right.
But the problem is they're not being FDA approved for cancer patients, because the money has to go into another pot for that.
So we're going to wrap this up really quick. Is there any parting wisdom that you can give Mary and I on how to be more fulfilled in our love lives?
One, I just want to say thank you for even broaching the topic, because there isn't everybody that would. And to be as candid and open as you two are is amazing. So I think, to me, continuing that dialogue outside of this room, as being open with friends and family. I know it sounds really awkward, but that's where we talk about it. Your nursing appointments, your primary care, you go in for a cold, be like, hey, do you talk to your patients about cancer and sex? And just open the dialogue, because for wisdom-wise, that's the best we can do, is by word of mouth. That's how we're going to get the training in the schools. That's how we're going to get people educated.
And where can people find you?
I'm at Associated Counseling Professionals at 132nd and Center.
Do you have a website or anything?
Briar,
Yep, you can Google me and you'll find me.
Alrighty.
Okay, thanks so much for being on our show.
Thank you for having me. I appreciate it.
And join us again for another Candid Chats on Cancer.
Hey, we'll see you next episode. Be well.